Great, so we should be live.
Great stuff.
Going to give everyone a couple of minutes to join us.
Mm-hmm.
And for everyone joining us now, feel free to comment in the chat, let us know you're here. We'll just give it a couple more minutes.
Sure.
Got Dragos with us. Hi, Dragos. Good to see you. Hi, Elaine. Hi, Everton. Good to see you. Hey, Anna. So just wait 1 minute and then we can get started. Hi, Katya. Right, I think we can probably get going and start with a little introduction. So thank you everyone for joining us on this Tuesday morning. So today's webinar is on the subject of how to be an effective therapist. So I'm sure you guys will have received our invite and kind of understand a little bit about what we're going to be covering today. But I'm very excited to introduce the host of today's webinar, Bhavesh Joshi. So some of you may already actually know him or attended some of the courses or lectures that he's hosted, but he's the director and principal of the London School of Massage, amongst many other things. But I'll let Bhavesh get to his own full introduction when we start with the presentation. But before we kind of get started on the main bulk of the webinar, just a couple of housekeeping things. So feel free to add any questions you have on the chat, and the kind of any of the bigger questions we will address towards the end. There'll be a few points within the presentation that are quite interactive, and we'd love to kind of have you guys interact with us. So those will become clear throughout the presentation, but any points where we ask for your opinions or thoughts on a certain question or topic, add them in the chat, and then we'll kind of like go off that. And I'll be keeping an eye on it throughout the presentation, and we'll share those with Bhavesh as well. So without further ado, I think I'll just pass on to you now, Bhavesh.
Hi guys, good morning to you, good sunny morning. Good morning in London town it is here. Hope the same is there for you. Thank you for joining us on this talk on how to be an effective therapist. Before I do the formal things here, just want to make you aware that I want to try and keep this whole thing relatively simple enough for you to take away something by the end of this, really make you a thinking practitioner. Okay, so that's the idea with this, that you go away here and you are able to apply what you know already, whatever level you're at. Okay, so what I'm going to do is I'm going to start the actual screen share. So here we go. And I hope you can all see the slideshow from here. Okay, great. Okay, so how to be an effective therapist. That's the chat for today. Before we do a formal start, Yasmin's already mentioned, but if you can get a pen or paper ready, I want to make this session an interactive one. It may be even easier if you type in the chat so that you can put your thoughts through. It's great to hear. No answers correct or incorrect. It's just an opinion, and that's what we really want to hear, how therapists are thinking, and hopefully by the end of this to help you make good clinical decisions at your level. That's the whole idea. Okay, but really interactive session. Make sure you get involved with this, just to try and improve yourself. It's really an improvement thing for your own self here. Okay, a little bit about myself. My qualification wise, I'm a qualified osteopath for nearly 30 years, acupuncturist for 22 years. Some of you may not be even that old. Kinesiologist. I've done all the complementary therapies, right from Asian styles to the Western styles. Work-wise, I'm director of the London School of Massage, which has been running for 28 years. I've been clinical director, College of Osteopaths, senior clinician to the London School of Osteopathy and College of Osteopaths again, and demonstrator of anatomy at the Hunterian Museum for the British School of Osteopathy. Currently, I'm a board member of the World Massage Council, which is a council which is trying to set professional standards within world massage competitions and massage across the board there. Look out for that one, please. I'm also a judge for national and international massage competitions. Yes, they do exist if you're not familiar with them, and there are new ones coming up very, very shortly, so keep your eye out, please. I'm on the panel for ThinkTree, which is an organisation registering practitioners. I'm a subject matter expert for massage, sports massage there. Have the privilege of being a massage specialist for Crown Prosecution Services, author, Secrets of Massage by Ivy Press, and fortunate enough to be an international lecturer, guest lecturer and a visiting lecturer for inviting countries. That may sound impressive, really. It's telling you how old I am, really, to be honest. So don't be worried about this. I always say this as an individual. I like to think I'm a nice guy. So please don't hold back questions. Yeah, if you have any questions at any stage, and we'll do questions in a second, you'll see how it'll work. Do ask away. We're always here to help you. Okay, so let's see how we're gonna just have a look at the brief overview of the talk here. How to be an effective therapist. Okay, so we're going to first look at the question of effective and what makes a practitioner potentially effective. Want to consider what information you want to quickly gain on meeting your client. That's going to be important for you. Things which you may need to change, may already be doing. Making a change, and really, number 3, being effective and efficient in the application of your therapy. Whatever level of therapy you're at, you can always improve, become more efficient, and you'll see hopefully how we do this. And last but not least, we have questions and answers right towards the end. Talk will be about 35-40 minutes, give or take, and if we have a little bit of more time, we'll introduce 1 or 2 extra things here. Okay, so here we go. Aim really is to get you to think and question what you're really doing in your daily activities as a massage therapist. So when you go out to somebody's place, client, or they're coming to you, you want to be thinking rather than going into sort of a conveyor belt type of mode where it's a come in, come out sort of process. You begin to think, so hopefully it'll make you a better therapist. Okay, so let's have a look at really, if we're talking about effective, we really need to look at the definition for effective, and if you look at the definition, it's successful in producing a desired or intended result. Okay, so successful in producing a desired or intended result. So 2 aspects to this here. Success is the first one. Okay, so the question here, the first question I'm going to pose to you, and your minutes coming up very, very shortly. Okay, I'm going to give you 1 minute here. How do you measure success in your treatment? So what is the measure of success? What makes you think, oh, that treatment was really good? Okay, so that's the question. So you have 60 seconds to write down your thoughts. I think I've got some groovy music for you here. Okay, here we go. Yeah, 60 seconds. Here we go. Get writing away, yeah, guys? Come on. Your answer isn't wrong, remember. Yeah, it's just an opinion, or you may have not understood the question properly. Get it going. Here we go. Okay. 3, 2, 1. Oh, be interesting to see. Yasmin, have we got anything there at all?
We've got Helen who says consistency, which is a very good one.
Yeah.
Still waiting to see if we've got any more coming through. We've got Everton saying client expectations queries have been addressed and hit the client expectations on the treatment. We've got Katya who says when the client gives positive feedback that I can focus on their needed areas. And we have Yvette saying the client's reaction.
Great stuff, yeah, and I think you're touching on all the stuff which I've got here. So let's have a look at them. Some things which I wrote down, which you may have here. Okay, some possible responses here. Well done, guys. Yeah, client reports. Yeah, approval by the client. Yeah, I really feel good. That feels fantastic. I feel really pain-free. Client books further treatments. That's a possible one. Yeah, that they think that you've been good in what you've done. And they've booked further treatments. So I've been looking at it from a little broader perspective, if you like. Client writes glowing reviews. Guys, don't forget this. Yeah, I mean, marketing is a different lecture and talk altogether. This is going to be your number one thing which will get you clients. Yeah, whether it's private clinic or you're on urban, make sure you get them to write your review. Yeah, when you do a great massage. Okay, always, please. Yeah. Client recommendations, they recommend you to somebody else. That's a good indicator, yeah. And great verbal feedback, really similar to number one here. Some of the said stuff about are really about client, they're indicators really of satisfaction, if you appreciate this, yeah. And some of you have actually hit on the other aspect of it, so it's absolutely brilliant to see. But the above really are an indicator of satisfaction. That doesn't necessarily mean that you've been effective in what you have done. Okay, you've given satisfaction to the client, but sometimes if you only know a certain level and a certain amount, then clients will only expect that amount until they, it's like tasting coffee. You taste coffee, yeah, at one place and it's great, and until you go to somewhere else and you taste better coffee, then you know the parameters of your how good and satisfaction is. So yeah, satisfied, yes, but you may not be hitting the effectiveness bar sort of fully. So this is what we really want to investigate. Let's have a look at the second part of that question then. So this is the second minute coming up for you here. Successful in producing a desired or intended result. So we're going to look at the second part here, desired outcome. What is the desired outcome of your treatment? Okay, what is the desired outcome of your treatment here? So how do you as a therapist assess the outcome of your treatment? Okay, that has been successful here. So 60 seconds again, getting ready. Yeah, here we go. Anything, don't worry, write it down, write it down. How do you know your treatment's worked? Get ready. Here we go, yeah? 3, 2, 1. It'll be interesting to see what you come up with this, okay? So here, look, really, Yasmin, it'll be great to hear. I'm not going to write anything down because by the end of the chat, you will then, I want you to reflect on your responses after the talk. Yep, so reflect on this, guys, because this is what the whole talk is about. But Yasmin, if there are any feedbacks there on that question.
So we actually had Florian who answered this we wrote this answer for the first question, but it's relevant for this one. Assessing and reassessing after each treatment to see improvement on pain and symptoms, and asking for feedback. We're seeing a lot of people are saying feedback. So Nikki's also said client feedback, same for Helen. We have Sandy saying to feel better, to cover all that the client needed. We also have Shelley saying increased range of motion more than before. We have Everton saying to ask the client if their pain level has decreased or level range of motion or relaxation has increased. We also have Aisha saying observation. And we have Elaine saying decreased pain, increased mobility, and improved range of motion and relaxation. So
Fantastic.
Very similar answers.
And absolutely brilliant. Guys, you're hitting it on the head. And I knew you would do this. And the idea with this chat is to actually put it into a format where it's like 1, 2, 3, 4. That's the idea. You know a lot about what I'm going to be talking about. Yeah, I've kept the topic simple enough for you to appreciate. But I want you to be able to, I want to bring it to the forefront, because this is something which you may be doing already. But I want it to bring it to your forefront, because then you can start applying. So great stuff. Reflect on this after the chat and see if you can add anything to what you have already. Okay, so here we go. Look, let's have a look at your working situation. Yeah, your urban heroes, as I understand. So I couldn't think of a more appropriate caption here. But your working situation is quite constrained. Yeah, so time is short. You've got that 1 hour. Yeah, client wants value for money. They want you to start immediately. They don't want all of this chatting which you do with them. Yeah, and then your constraint also is that you have to finish on time, get ready for the next client, etc., etc. So your constraints are there where you need to make sure that you're effective in what you do, but I also make sure that the client is also happy. So satisfaction is going to be really important here. For you to actually get the clientele on a repeated basis. Okay, so this is a working situation, and we can add to that, but you've got the crux of it here. So let's have a look at. So before we start any of this, I want to make sure that we do this, please. Yeah, let the client know why you are going to do what you are going to do, and this is in relation to what I'm going to suggest you should be doing. Okay, so this is what you're going to ask or tell your clients from now on, if you take up the recommendation, if you're not doing this already. Okay, so that's the idea with this. Okay, so this is really that little sentence is relating to stuff which you'll be looking at further. But the why really is this, that why you're going to be taking a little bit of more time, not just massage, but asking questions and doing what we're going to do in a second, is it will enhance their treatment, and it will make you adapt the techniques and method to suit their requirements. Now, it's really important you do this, yeah. And I was trying to think of an example, and the one that comes to mind is something like this. If you bring an electrician to your house to change a socket, just a socket sort of downstairs, and your fuse box is on the second floor, if he doesn't tell you why he's going to the second floor to mess around with the switches, to take the current down, to switch off the power, then come downstairs and change the socket, he's done everything safely and appropriately. But if the house owner doesn't know why that's being applied, then it feels like, oh, he's just wasting time and therefore he wants more money, etc. So unless you tell your client why you're doing what you're going to do, it doesn't really work, because there's also a question in the mind. So let them know why you're doing it and what you want to do, and then it will really, really help you and benefit your treatment. Okay, so I'm going to do this, yeah? They may sound similar questions, but here you go. Okay, so 2 questions, 1 action. This is what you really want to do. Some of you have already answered it, which is really fantastic. But you want to really ask 2 questions. You want to ask your client 2 questions. This is the first one, presuming the medical history is okay. Okay, so you've taken the medical history is okay, and there are 2 questions which you want to really ask. Okay, what 2 questions will those be for you? Okay, so we have 60 seconds. Here we go. 2 questions, 2 most important questions that you want to ask. All right. Yasmin, any stuff there?
Give it a little bit of time because it's a bit of a lag. We've got
Sure.
Nikki who said, what's your desired outcome of the treatment? So asking the client that question. Florian's said, where do you feel pain and for how long have you felt that pain? We also have Helen who said, how are you asking the client how they're feeling today and what area that you'd like them to target? And we also have Yvette saying, how do you want to feel after the treatment, or what are you expecting from your treatment today? And we also have Sandy who said pressure, asking for what pressure they want to have during the treatment and their expected outcome.
Fantastic. You're hitting on the head there. Yeah. Okay. So here we go. The questions. Yeah. Okay. Two questions which we want. Okay. So the reasons. Yeah. The reason. What is a reason which you booked a massage for Mr. Smith? Yeah. What's got you wanting a massage today? Don't keep it that formal. My statement there is a little bit more formal. You can make it informal, so it can make it part of the setting up process as they are around there. Okay, it doesn't need to be a sat down thing and do it so that they'll let you know. But you need to know the reason why, and it could be something like, you know what, I've been really stressed at work. Yeah, have a stressful day at work, and I just need a me time. It's guiding you towards something. Yeah, whereas Mr. Jones will say, you know, I've been painting or I've been playing football, and the muscles are a little bit achy. So it's a little bit different type of treatment. One's more mind, one's more body, if you like. Okay, just as an example. So that's one of the possible first reason. The other one, many of you got this one. Are there any specific areas you want me to concentrate on? Yeah, these two questions are a must, and they don't take you that long. The client can find, you know, the areas, and they'll point to areas which are hurting or causing them problems, because once you address the areas, it will really assist you in determining and you know, doing a treatment. So information then provides you with the direction to the type of treatment you give them, whether it's a deep tissue massage treatment, whether it's a manual lymphatic drainage, whether it's holistic massage, deep tissue sports massage. You know, this will guide you. This will really guide you towards the type of treatment which you do for your client. Okay. The second thing, helps you to use specific techniques in your treatment application. Okay, whether it's soft tissue massage techniques which you do, whether you use neuromuscular techniques, whether you do stretching. So it helps you in really two ways there. And the third one really helps you to focus on specific parts of the body where your client has guided you, so that you can then become much more focused in your application and how you apply that. Okay, so this is what this information is going to help you with. What techniques you're going to use, what type of massage you're going to use. Okay, that's this is going to help you with. Okay, so let's go on to then the second part is the action. So two questions, one action. Recording your palpatory findings. So here what we want to do is, my suggestion, and a lot of you some of you may be doing this, some of you may not be doing this, depending upon what level you're at. If you've done sports, you may be doing this. So creating a body map. Okay, now creating a body map helps you to focus on the areas which are issues, and it will also provide the client a visual representation of your findings. So I've just got the posterior body for explanation here. You could do the anterior one here as well. It's palpating. So I've used a little bit of a key here. X equals tight muscles. Okay, so on this diagram you can see that I found tight areas across the shoulder here, tight areas in the low back there, across the gluteals here, calf, and then I've got these knots, yeah, which I found, which I've also added in. Okay, this curve is showing you the curvature of the spine, and this can be done during the massage. Yeah, it doesn't need to be done specifically, or you can say, and as I advise, let your client know what you're going to do while you're doing it. You could, right at the beginning of the treatment, palpate. Just do a quick scan palpation. Get this info on your in your notes there, yeah, before you start, because what this does is it makes the treatment bespoke for your client. They feel that this is going to be useful, and once you show them this, Yeah, this is a visual representation of the areas of the back. Yeah, something visual is really going to be important for your client. It's something new which nobody else has done before. Yeah, it will really set you apart from everyone else. Okay, so this is what it does. It shows the client, oh, you know, I've got an XYZ problem here. They can see where the tight areas are, and it gives them a reason to book you back in again. Okay, this is what this is going to help you with. This will help you book the client back in again, as well as help you remember where the tight areas were, and then you do your quick scan again next time, and you find out if there have been any changes within that area. Okay, so that's how you're going to use this treatment, this body map here. So 2 questions, 1 action is what you want to do at a minimum, and hopefully that will change the way you're going to apply your treatment protocol. Okay, so let's have a look at making a change and being efficient in what you do. Okay, so if you look at effective treatment, if you want to do an effective treatment, then one element of this effective treatment is the therapist. Okay, and so how does a therapist do an effective treatment? Okay, or how does a therapist become effective in what they're doing? Okay, and this is what you really want to pay attention to. Okay, good body posture. Okay, good body posture. There's nothing like it. To be honest, I rarely YouTube. I go on it. I rarely see good body posture. Yeah, good body, and you'll see why I'm saying this in a second. I see very low stances. I see, you know, these classical martial art type of stances, which we're doing massage, we're not doing martial arts. Okay, martial arts are good for posture, they're good for center of gravity. Yeah, I studied martial arts for almost 30 years, so I know about the posture aspect and martial arts stances. But massage is different. Yeah, an awareness of your body posture is really important. That's what martial arts gives you, but you don't need to take the stances of martial arts here. Okay, you want to reduce joint strain, yeah, body strain when you're doing the massage. And you want to be able to focus on the areas which have been outlined, and where do you know, or where the problems are, from the palpatory aspects of your chart which you've done before the body map, as well as your client telling you where the areas are. Okay, don't by the way, going back again to that palpatory chart, don't try to find, you know, if your client knows where those achy parts are, let them find it for you. Why do you want to start finding it? Sometimes even clients have difficulty finding it, so you'll have a greater difficulty. Let the client find the area which is causing them problems, and then you can home in. That's what you want to do. Okay. What does this do? What does this? How does this make it efficient? Really, this is what you want. Okay. This results in efficiency. Okay, this makes you efficient in what you're doing. What do I mean by efficiency? It means that you use the least amount of effort and you get the greatest output. Okay, the least amount of effort, greatest output, i.e. you don't want to work hard. Yeah, low stances will really tire you out on your thighs. If you want to do your martial arts stance, drop the table and then start doing them, and you can do your Pilates and your martial arts training and train the quadriceps, etc. as you're massaging. That's great stuff. Yeah, you're killing 2 birds with 1 stone because you can't go to the gym that night. That's fantastic. But if you want to become efficient in application of your massage technique, the best position to actually do the massage is in a standing position, knees slightly flexed. That's it. Okay, just as a starter for you. Okay, you don't need to take deep stances, guys. You need to know how to throw your weight, and that's important. Okay, keep that in mind. That's another topic altogether. It's a more practical one. On the other side, we have is a client, and we're looking at the client here, and the question really comes now is, how do you know if you are making a change by what you're doing? Okay, and I'm talking about how do you know you're being effective in your application of the techniques which you're using? Okay, you have 60 seconds. Yeah, here we go. This is the last one, yeah, guys. Okay, here we go. see what we've got here, guys. Yeah.
Give it a couple more seconds, but we've got Helen saying range of motion improved.
Yeah.
This one. And the client rebooks as well.
Having said that, that client rebooks is really more satisfaction. That doesn't really, I mean, great, yeah, and you may be doing something right, which I'm not saying for no for an answer, but it's that satisfaction. This is stuff I want to sort out. That you sort out satisfaction from being effective. So I've really made two things here, which is really important. Yeah.
We also have Yvette saying pain reduction as you proceed. The client starts to relax to your touch on where they started out as tense. We also have Dragos saying you'll notice physical and or emotional improvements on your client during the session and after the session. And Nikki saying change in the feel of muscles and client feedback during the session. And Sandy also says their feedback during the session.
Great. The feedback, just to clarify, the feedback is just a marker for you to know a little bit possibly about pressures, if I'm not mistaken. It'll also tell you about pain as well, but more about pressures as well. So the feedback is something I will use to determine the depth of my pressures, etc. Okay, but it won't in a way determine if you're making a change, if that makes sense. Okay, you may be meaning something different. Look, here's something for you which I've done. Okay, lots of things which you want to, and you all know this, guys, because you deal with this all the time. I think Helen said it before, actually. Range of motion is there, right at the bottom there. Okay, you get increased range of motion. Before we go into that, let's go to the top here. You feel tissue changes. Yeah, the tissue becomes a lot more pliable. It's more malleable. Yeah, the tissue becomes softer. You know that already, guys. Yeah, it becomes warmer. Yeah, it becomes much more warmer. There's a lot more heat in the area there. You know you're making a change there. It becomes red. Yeah, which is indicating increased blood flow to the area there. Blood is really important. Don't underestimate flow of blood. You know, blood flow is everything. Yeah, if you appreciate this, blood flow will bring nutrients to an area, help drain waste products away. You know, it's a simple sentence. But if your heart doesn't get enough blood, yeah, you end up with angina, heart pain. If it doesn't get enough, you end up with a heart attack. Same with your brain. If your brain doesn't get enough oxygen and nutrients, enough blood to the area, what will happen is you suffer a stroke. Okay, so just giving you some examples why that. Don't look at, you know, blood supply as something low. Blood supply should be top on your list. Yeah, increase flexibility. Yeah, if you're applying stretching type of techniques to the area, you may be looking at improving flexibility and range of motion. I'm hoping people said range of motion as a result of articulating joints. Yeah, we're looking at now different joints there, different motion there. So you've got different techniques coming in, and of course, you know, reduction in pain, which will be important. That's something that the client reports. What I haven't talked about here, somebody actually, is it Dracos, I think, Yasmin, who's talking here? He actually mentioned, I was going to bring it in here, but look, these are physical stuff, isn't it? This is all physical on a body level here. Pain may be subjective, yeah, but there could be a mental element to this. So there's a mental element here, and, you know, how the client feels in their mind. That will be a really important one to do as well. Okay, so in my beginning example where I said somebody had a really stressful day, you want to use your mind, you want to use your massage to actually concentrate more on a mental aspect of the massage, where it calms people down, etc., as opposed to one being more physical in terms of its application. Okay, so please be aware this is a more tissue awareness, and this is what the key word here is: tissue change. You want to be looking at tissue change, guys. Yeah. Whenever you're doing something, look at tissue change. Why you're doing it? I want to implement tissue change. That's going to be your key thing here. Okay. Begin to think about this. Efficiency. Am I being efficient? And am I getting tissue change here to the areas which have already been indicated to me previously from my body map and from my client feedback during the actual initial consultation there. Okay, two things which you really want to pay attention to. Okay, Don't forget this. This is key, guys. This is key to making you a better therapist. This lot here. Okay. I'm going to give it away. Yeah. The big thing which differentiates your massage therapist who's just done the massage course to somebody who's done a little bit higher physiotherapy, osteopathy, chiropractic, who's a body therapist, done other stuff, is that those guys have an aim in mind. And once they produce the aim, yeah, they're interested in producing the aim, not using fancy techniques. I've taught too long to see students doing all these fancy techniques which can cause issues. We'll come back to that very, very shortly. But I hope this is making sense for you guys here. Okay, keep this in mind. Really, really important. Yeah. Okay, so let's go on to palpation and proprioception. Palpation, proprioception. Too long a time. People always come back to me in the class and say, my last course didn't show me how to palpate. Proprioception, by the way, means body awareness. Okay, that's joint position sense where your body is in position. That's what proprioception is. Palpation is all about feeling, okay, not palpitations, okay, just to make sure we get our terminology right. So palpation, and I always chuck it back and I say, you know what, how do you choose your tomatoes? Sometimes I choose lemons, okay, how do you choose them? And what people say to me is basically, well, I'll squish them. I palpate them. I feel them. So I said, great. So what do you feel then? And how do you choose the tomatoes you want? So they'll say, look, I don't want the too squishy ones, and I don't want the too firm ones. I want the ones which feel like in between. Usually this is the common. So that's how I choose my tomatoes, and I normally give feedback, and I say that's great because my wife, Mrs. Joshi, she chooses tomatoes by choosing the middle ones, squishy ones, and for tomorrow she'll choose the ones which are more ripe. So what I'm trying to show you here is you already have palpation in your hands. Yeah, you've got palpation there. Yeah, think about when you're squishing your bread of a loaf of bread when you go to Sainsbury's. You want a crusty one, you want a soft one. You've got palpation to hand. Don't chuck that away, guys. Yeah. So when you're palpating, when you're massaging, you're not just massaging. You're also palpating. You're also feeling. If you're not doing that, that's really important that you apply that throughout your treatment. You're always feeling, and then you're always going to be adding to your chart as well. Okay, that's really important. So palpation is not beyond you. Okay. What I do want you to appreciate is proprioception, and they go a little bit hand in hand, because with palpation, when you're palpating, you shouldn't really just be feeling with your applicator. I'll talk to you about applicators in a second, but it's a little bit more than just feeling with the body part you're contacting, whatever it is, elbow, forearm, whatever it is which you're using. It's more about that. The analogy I usually give is if you drive, when you're learning to drive, your instructor will normally say, if it's a manual, go to 2,000 revs before you change your gear. Okay, and then you look at the rev counter, change the gear at 2,000 revs. Now, when you get a little bit better, you find that you change that automatically. You just know. So what is it? You're not looking at the rev counter anymore. How do you know the gear needs changing up or down? Okay, and that's usually through a feel. And it's not a feel through holding the gear stick that you're feeling that the gear needs to change. It's a body awareness of how that car is struggling, or how that car is being over revved. You feel the whole car through your own body, and that's what I'm talking about with proprioception. Okay. The other analogy, if that doesn't relate to you, is when you're writing with the ballpoint pen. What are you actually feeling? Why is one ballpoint pen really nice, and you say that's a fantastic pen, and you come to another ballpoint pen, a Bic, which has been left in your drawer for many years, and you write with it, and it's not a good Bic. It's writing a bit rough. What is it about that which is making one pen a really good one not? Okay, and it's coming down to it. It's the feel. It's the feel of how you're feeling the movement there. And then what I'll say to you is, what are you feeling? Yeah, because you're not feeling the ball and the paper itself, are you? You're feeling through that whole system to actually be aware of it. So when we are palpating, when we are doing technique, you should be using just the applicator which is being applied to the body. It should be more than that. It should be a more body awareness. Yeah, if you're taught body awareness and how to apply that and do your techniques that way, that is making you efficient. Okay, because you're getting a lot better feedback. Okay, you'll notice I'm not talking about techniques. That's the important bit. It's not about techniques. So even if you're newly qualified, it's not about the amount of techniques you know. It's more about how you're palpating and how you're trying to do the tissue changes. That's what's going to be important for yourself. Okay. So let's have a look at body applicators. These are obvious. I just want to quickly go through them just to make sure. Okay. Fingers. Yeah, avoid fingers. Yeah, please, 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 please avoid fingers. Too many joints there. This is a classic picture. I keep this picture in my notes there, okay? And you'll see that these fingers are used, okay? They look off the person. Too many little joints in between here. The angle of that shoulder is incorrect. Everything is wrong with this picture you can get. It's there, okay? This is bad technique. It's not a good way to do it. Yeah, so avoid fingers. Too many small joints there. To do techniques. Thumbs, be careful please. What I'm showing you here is a reinforced thumb, and that's a very, very good applicator to use in your techniques. Yeah, the thumb here has been left open so you can see the positioning. Okay, now when we're doing it, we don't show that thumb. Yeah, this hand is actually pushing. This is the pushing hand. That thumb here is actually like a piece of wood, if you like. So this hand is the pushing hand on top. Your thumb sustains no stress or minimal stress as much as possible. I'm not talking about thumb petrissage, which is going round and round. That is poor technique, okay, because that's using a small joint. If you want to do circles like that, it really needs to be shown properly, yeah, and then you can use your body for that, okay. Heel of hand. Heel of hand for me is king of techniques, king of applicators, I should say. Absolutely 80% of stuff is in my techniques in my clinic, even as an osteopath, was done with heel of hand. 80-90% of it is there. Heel of hand, king, because it doesn't make you bend. You're doing this from an upright position. Yeah. Watch the angle. You may have been told this. If you're not, watch the angle here. Don't keep this up, please, or don't keep it too little. Okay, don't go right angles here. Keep this as straight as possible. Watch your fingers aren't up. Okay, so keep your fingers relaxed here. Really, really important. Yeah, can't stress that. Otherwise, you end up getting the tennis elbow, which is common. RSI. Okay, fists. As an applicator, you know, you want to advertise your clinic. Fists look really powerful and strong. It's not the best applicator to use, in my opinion. You can use it in given areas. If you trained with me, you'll know why I don't use the fist a lot here. Just as a starter here, you're already using muscles here on your forearm flexors to actually curl the fingers, yeah, which is unnecessary, because if I'm using the fists and the fists are my applicator here, okay, then basically, well, the heel of hand is the same surface area as this, so why use the fist? Yeah. On the border of the forearm, it's a great applicator, yeah, nice and relaxed wrist here. You can use just one side, both sides. It's a great applicator there. And then the last one there is your elbow. Yeah. So here in my application, then I have really look, small here, okay, medium here, and large here. My small, medium, and large applicators. And then with my reinforced thumb for specific technique, I've really got everything I need in terms of tools. I don't need to really do much more than that. Okay. And these are good tools to use. Okay. Just a suggestion, try not to move your wrist, try not to do these sort of movements here, which I see massage students doing a lot. The novice ones, please don't do that. They're not really good for your fingers. They may feel brilliant for your, the client will say brilliant for the massage, but they're not really great for your own self, so keep that in mind, okay? So which applicator? Okay, it's as easy as stirring coffee. Like I say, so I use this example a lot. It's as easy as stirring coffee, but, and that there's the but here, you've got, but see, I hope you can see this, but it's on the small screen. I think they can see. See, applicators are like this. Yeah, they're like spoons. Okay, so hope you can see them. Yeah, and I have applicators or I have spoons. If I were to say to you, which spoon would you use in stirring your coffee, the small, medium, or large? I think correctly you would say small, which will be adaptable to that coffee. Okay, I do have a large spoon. I have it in my repertoire. I have that there, but it may not be the right spoon to use in this circumstance, and that's what all applicators are. They are just different size spoons. Don't get wrapped up with trying to apply every single applicator. Yeah, keep that in mind. That will make you efficient in what you end up doing. Okay, keep that in mind, please. Yeah. It's very common in people who've been in deep tissue work, who've done deep tissue work over the weekend, and then want to apply every single applicator they've learned on the first patient they see. Okay, the but comes in here. Although I use my small applicator here, yeah, I've got a variety of ways of mixing. So follow the cursor. I can do a mix that way. Yeah, I can do a mix this way. I can do a mix up and down if I wanted to. Just move my hand up and down this way, just as suggestions. I don't need to use a spoon. I can move the whole coffee cup. Yeah, there are a variety of ways in which I can move this, and that's the options which you have. Okay, those are the applicators which you will use. You want to use the correct applicator to do this. And how do you know you use the correct applicator? Because you're going to be efficient in what you're doing, not stress yourself out, and you're going to be making tissue change. Those are the two things which you want to do. Okay, that's going to be important for you. Summing up then, here we go. And if you have had any questions, I think would be a good time to actually start posting them to Yasmin, possibly right now if they can. There's always a time lag here, as I understand. But let me sum up here and say, look, find out what your client wants from the treatment. That's the first thing. Just make sure you do that. Yeah. 2, evaluate what your client needs from the treatment by palpating before as well as during the treatment. That's going to be important. Okay. Aim for tissue changes. So through palpatory and client feedback is important. Make sure that you get the aim for tissue change. Make sure you get the changes there. Okay. Watch your posture. Maintain efficiency in the application of your technique. Use correct body applicators to create the desired changes. Okay. And a little bit of an osteopathic thing here. We were always taught, find it, fix it, and leave it alone. Okay. Which is really talking about you don't want to over mix, yeah, cream or milk. If you over mix milk, you don't end up with cream, you'll end up with butter. If you don't want butter, then you've mixed it too much. Okay, so that's where we're really going to find it, fix it. So make the tissue changes, get feedback, make sure you're not over treating the tissues, and then leave it alone, let it be there. Okay, and that way you'll do some good treatments there. Okay. Hope you've enjoyed this. If you're interested, you can visit the London School of Massage.co.uk. Some courses which you may want to look at, deep tissue massage. I know these are on the Urban website there. Trigger point therapy, advanced therapeutic massage, which is a clinical application of the deep tissue massage techniques. Stretch massage therapy, quite unique to the school, which we do stretch with combined with deep tissue strokes there. If you want to take it further, there are ITEC sports massage diploma courses, level 3, 4, or 5, which should take you further. Okay. Lastly, I've got to say a big thank you to Yasmin, to Urban as well for the invitation to speak. It's been a pleasure, an honour to just share a little bit of knowledge here. Hope you're all keeping well, and a big thank you to you all for joining us today. Yeah, hope it's been useful.
Amazing. Thank you so much, Bhavesh. That was incredibly insightful. We've had one question come through from Everton, who's asking, do you have any mobile application tools you would recommend to use for client body scan, or like to figure out what tight areas, as you mentioned earlier, because the physical consultation form won't always be in hand to show back to them?
Sorry, so do we have any tools? Was that the
Yeah, like I think, yeah, any application tools you recommend to use for the body scan? Do you use a physical like drawing, or just a kind of
sure.
thinking, like having it in your head? Or
These ones. These are the best tools you can get. Good question. And it may be coming from somebody who's maybe not club. Look, you can feel, that's why I was actually talking about tomatoes. These are the best tools where you begin to feel. Initially, if you haven't done this before, you may not be able to feel as well because you haven't been aware of it. But as you begin to palpate a little bit more, you'll begin to appreciate the changes. Let me share with you something then here, is what you want to do is first make sure your anatomy is good, because anatomy's got to be good. Then you'll know where the tight areas are, be your muscles I'm talking about, especially bread and butter for therapists, really. I always say this, anatomy, especially muscle origin, insertion, action, is bread and butter for therapists. You must know this. Then learn to palpate at different levels. Do this on yourself first if you're not sure, or do it on your partner if you're not sure. Learn to palpate, learn what you're feeling, go through the adipose tissue, go through the top layer adipose tissue, feel the blood vessels, feel tendons, feel muscles. Okay, learn to differentiate, learn to feel what tight muscle feels like. Okay, and you'll begin to get a good map. These are the best tools. Yeah, if you use anything in between, it's like putting a pen in between your hand and the area which you're going to massage. So I would recommend these are the best. Yeah.
So I think that what Everton meant was, in terms of the actual image of the map, to be able to physically demonstrate to
I
the
beg your
rather
pardon.
than, it's all right. I think I
Yeah.
misunderstood as well. So instead of actually, like, not actual tools to use with your hands, but being able to visually demonstrate those.
Yeah, none at all. None at all. I would just have that that on an app, if you like, not on an app, sorry, on an iPad or anything like that. And if you're able to actually draw the map on the person with your iPad, that will be the best thing, I think, to keeping it really simple. Have a Word template there, and on Word, I know you can write, and I know the new tablets allow you to write as well. So that would be my suggestion. Make sure you name the person, yeah, on your thing. Just as a point of warning, remember, if you're storing client data, Data Protection Act applies. So just keep that in mind, please. Okay, but yeah, just the app. I don't have any apps at all, unfortunately, in my repertoire, and it's something worthwhile producing. In fact, it's quite good.
Amazing. We've also got Nikki asking, saying she's very keen on upping her skills to be more clinical, currently at level 3 with additional deep tissue. Would you say it's best to take a level 4 or 5 course, or take lots of smaller courses?
Really depends on what you want to achieve. So the smaller courses really tend to focus on specific things, if you like. So I don't know whether she's done any courses before, but if she does something like deep tissue as an example, yeah, that would tell her and work on the deep tissue. Whereas if you really want to take it clinical, then the sports massage is the current way, where it says sports massage, sports, but it's not. Look, sports is just it's a bad term, whether you trip, you injure your ankle playing football, or whether you do it on the curb, you injure the similar tissues. Okay, and therefore the treatment is very similar. So sports massage, really, yeah, but it's really soft tissue injuries. That's what we're really looking at. So if you want to go that way, then go through the sports massage, because your deep tissue will be included within that, or should be included within that, the aspect of it. What you don't get is the focus on the deep tissue element of it, if that makes sense, yeah? Whereas you get 2 days, as an example from LSM, you get 2 days deep tissue here. When you come onto the sports, it's like, okay, this is how you use this, and this is how you use this. Let's get tissue change. That's what we're interested in. Okay.
Amazing. And one final one, we've got patients asking, can you use one single technique for a whole massage?
Yes. Yeah, you're hitting on the head. Yeah, absolutely. Heel of hand, 90% of the time I do it. Absolutely. Yeah. Does that get client satisfaction? It's a different question altogether. You see, this is what I was trying to marry up. You've got to get client satisfaction with the efficiency of your treatment. So there's 2 aspects to this, and this is what's really, really important. That the satisfaction element of it may be gained by using different applicators at different levels. Yeah. but never to strain your own body. That's the important part. But can you do can you do a massage with one element? Yes, you can, absolutely. Heel of hand, yeah, that's the best one, in my opinion, to use, because it's the easiest one to use. If the client is satisfied with that particular applicator and they just fall asleep, great, do your full technique. Because remember, look, you've got depth to worry about, you've got direction to consider. Yeah, so there are parameters with this. You've got to stretch, massage, muscle tissues with it. So there are parameters you could add to the one applicator. Yeah, so don't think it's just going to be flat. You can make the treatment really exciting, but knowing on how to apply the applicators or the different parameters to your one applicator, yeah, absolutely, why not?
Wonderful. Well, I think that wraps up the questions for today. Thank you so much, Bhavesh. That was incredibly insightful, and everyone seems to feel the same in the comments, and they're saying thank you very much. Thanks to everyone who's joined us today, and I hope that you guys have gained as much as I have from this. And yeah, I think that we'll wrap that up for today.